Wow, such a privilege to hear those stories of courageous young people who are in such difficult and often dangerous situations. And also encouraging that so many organizations are uniting to support young people in times of crisis. Great stuff.
Yeah, great stuff indeed. We are so ready to learn, and the Ready to Learn session had a lot of food for thought. It was fun to hear adolescents from all around the world telling us what their ideal school looks like. And now we've got two coming up. Of course, the first one is Generation Cyberwise, fostering safety for natives. That's highly topical for sure. And that's one that's really close to my heart. I love all things technology. So dial into that if you want to be a part of the conversation with young voices and experts about building a safer and more supportive online space. Or you could go to the launch of the AHA 2.0 Global Guidance for Accelerated Action for Adolescent Health and Wellbeing. That's an interactive session to showcase country examples on applying this framework to the local context.
And we've also got interesting videos for you from Gavi, the Vaccine Alliance. Did you know that cervical cancer caused over 340,000 deaths in 2020? Now, 90% of those were in low and middle income countries. Now, we can stop this, which is why it's so important that girls get accurate information about the HPV vaccine. And we also have more news from our Spot 1.8 reporter. Take it away, team.
Unite! Unite! Rise! Rise! Lead! Lead!
We are seeking to eliminate cervical cancer in Sierra Leone. And part of that strategy is vaccination, the HPV vaccine.
My name is Karen Nakawala. I'm from Zambia, and I was born in a town called Chipata. I'm a cervical cancer survivor myself. So I was diagnosed in 2019 of June. So I was driving back home, I remember, and suddenly it hit me, cancer. This means that I'm dying, and I parked the car on the roadside. It was about 7 p.m. And the first thing that came to my mind was my children. I'm going to die and my children are going to remain alone. And I broke down. I remember I broke down for the longest time. For 3 days, I didn't sleep straight. Like I would wake up, literally see the sunrise, sunset for 3 days. The treatment is very harsh and it takes a lot from you. Even the strongest person, I think at some point, you literally give in to the treatment. And so to get out of that, I think I'm very lucky to be here because there are a lot of women that I saw that died during my journey. I now realize that if we are to eliminate cervical cancer, the HPV is the one sure tool that we have to do it. So the HPV in Zambia was rolled out in 2013. When I started talking to the doctors, they told me that it was met with a lot of resistance. One, because people did not believe in the vaccine, and two, because of what the vaccine was related to, cervical cancer and, the sexual part of it. And so that is when we decided, you know what? Yes, we're doing the screening, we're doing the awareness, we're creating demand for people to go and get screening. But I think our fight is trying to get the HPV rolled out successfully and getting the girls that are eligible to get vaccinated. We're losing a lot of women unnecessarily, and I think we shouldn't. We can't lose women to a cancer that can be eliminated and to a cancer that can be prevented. And that is where the HPV vaccine comes in. And we need to push for that to be received by the masses so that they can get their girls vaccinated.
Hi, I'm Elizabeth. I'm 21 years old. I'm a computer science student from Namibia. I think my biggest aspiration is always to inspire other people, helping young people know that despite their circumstances, their background, they can achieve anything they want in life. For my friends and I, it's also been a challenge to find job opportunities because due to lack of formal education and work experience.
So Yoma is a digital platform for young people to upskill themselves. They can sign up, they can do learning courses, they can do volunteering opportunities where they can impact their local communities. In return, they earn tokens, and these tokens they can redeem on a marketplace for digital and physical goods.
By completing the Yoma courses, I was able to add to my CV, which actually helped me to gain some work experience in digital marketing. I see a future where young people will have access to formal education, will have access to gain experience and be able to achieve their personal goals and their career goals with the help of Yoma.
Hello, everyone. I'm Anuradha Gupta, the President of Global Immunization at the Sabin Vaccine Institute. And I'm so delighted to be with you for this virtual forum. It is indeed exciting to be a part of the enthusiasm and energy that you, the 1.8 billion young people, bring to our global community. This forum is about how you all can force change, accelerate change, shape lives, improve lives, and most importantly, save lives. I can tell you about one more opportunity that you have to do that. It is about preventing the horrific human papillomavirus that leads to cervical cancer among women, but also cancers among men, including head and neck cancer. Unlike other cancers, cervical cancer can be prevented and eventually eliminated. We have a highly effective vaccine that prevents HPV, and we have screening and treatment methods today that detect and remove precancerous lesions much before they develop into cervical cancer that today claims a woman every 90 seconds. These deaths are mostly among younger women. And the tragedy is that though they are preventable, HPV vaccination coverage remains very low. Only 1 in 7 young girls received the vaccine in 2022. HPV vaccine is best taken when you are an adolescent between 9 to 14 years of age. So I would urge you to take agency of your own health. Demand that you get protected by this powerful tool that can prevent cancer and also other HPV-induced cancers. Be your best advocates. Your voice will be important to end cervical cancer that is unnecessarily killing women in the prime of their youth. If we and you don't act now, a woman would die of cervical cancer every 60 seconds by 2040. Don't allow that to happen. Imagine what you, 1.8 billion young people, can do. Thank you.
Unite! Unite! Rise! Rise! Lead!
Okay, I think we're getting started. So, hi everyone, good morning, good afternoon, and good evening from wherever you're joining from today. Thanks for joining the Global Forum for Adolescents. My name is Gareth. I'm the Vice Chair for the Partner Engagement and Countries Committee at PMNCH, as well as a member of the WHO Youth Council. And I'm really excited to welcome you here to the global launch of the newly updated AHA guidance. So during this session, you will hear from adolescents and young people, representatives of UN agencies and countries on their efforts to improve adolescent health and well-being and the key role that global guidances such as the AHA play. And I'm really excited to be able to present this to you today with my colleagues, as I've also been involved in the update of this. So it's very exciting to see how all of our inputs have been incorporated into it. So just some quick information for those of you in the audience. We do have an interactive session or interactive panel as part of our session. If you have any questions, please do add them to the Slido link. You should see it in your chat. And you can add any questions that you may have, and then we can put them to the panelists towards the end of the session. Within Slido, you should be able to vote or kind of upvote on different questions. So if you see a question that is similar to yours, or covers the same topic, don't feel like you have to add in the same question. You can just do the thumbs up, and then that'll flag to us that that's a really important question for you. And we hope to get responses from both our UN agency colleagues and, of course, our adolescent and young leaders as part of the session and hear from their valuable experiences. So without further ado, I think it's time that we hear from some of our young leaders. So first and foremost, I'd like to introduce Shukti from the YP Foundation in India, who will be speaking about her work. So looking forward to that video.
Hello everyone. I'm Shukti A, representing the YP Foundation from India. I was also a youth consultant for the technical working group on the AHA, which is the Accelerated Action Towards the Health of Adolescents. The AHA guidance aims to assist governments in identifying national and subnational priorities and implementation strategies as they respond to the health and well-being challenges, opportunities, and needs of adolescents in their countries. It is intended as a reference document for national and subnational policymakers and program managers to assist them in planning, implementing, monitoring, and evaluating adolescent health and well-being programs. Adolescents and youth are the future. They are the ones who will inherit the world and face the challenges of tomorrow. That's exactly why it's extremely important to invest in them and ensure that they have the skills and knowledge that they need to thrive. One way to do this is to meaningfully engage adolescents and youth in the design and implementation of policies, programs, and services that affect their lives. This is known as meaningful adolescent and youth engagement. MAYE is a mutually beneficial partnership between young people and adults, where both parties work together to achieve common goals. It is not about tokenism or simply giving adolescents and youth a seat at the table. It is about giving them a real voice and a real opportunity to make a difference. Ensure that they have the skills and knowledge that they need to provide them with training and mentorship opportunities. When adolescents and young people are meaningfully engaged, they are more likely to be satisfied with the programs and services that they receive, and they are more likely to achieve their full potential. Thank you.
Hi everyone, I'm Rahman, and I'd like to tell you about an exciting initiative which the World Health Organization, PMNCH, other UN partners, and young people across the world have been working on. Drum roll, please. It's the second edition of the Global Accelerated Action for the Health of Adolescents. Now, this is a big deal because this document has been written by technical experts informed by young people every step of the way, to assist governments in deciding how to respond to the health and well-being challenges, opportunities, and needs of young people. Let's get into why this guidance is so important. Sharifa, please take it away.
Thanks, Rahman. Before proceeding, let's remind ourselves of the facts. There are 1.8 billion young people aged 10 to 24 years old in the world today, and 1.2 billion adolescents aged 10 to 19 years old. Yet, there aren't nearly enough adolescent-focused health and well-being programs, policies, and financing. So the question to answer is, why don't we see more action for adolescents' well-being? Right, Dashana?
Right. If decision makers focused on some of the main health and well-being issues adolescents face, we would be building much resilient, healthier, and happier communities. So, what is in this new edition of AHA Guidance, Sharifat?
Well, this new edition is a step-by-step guide to the national or subnational programming process. The guidance first looks at the most important health and well-being issues for adolescents globally and regionally. It then takes the reader through ways to identify national priorities for adolescent health and well-being through a consultation that also meaningfully engages adolescents and youth. The guidance outlines options for programming with key messages on ways to implement strategies, and most importantly, it supports policymakers in designing effective measurement tools to enhance accountability. So, Rahman, what can young people do now to make sure we continue to be involved in this process?
As a young advocate, you can make sure you're involved in the implementation of these recommendations by calling for your decision makers to engage you in their process so that your opinions and concerns are heard and responded to.
Brilliant. I hope you all are as excited as I am to hear from our young colleagues. And in particular, I think the important thing to take away from that is while we're launching the AHA guidance today, this is only the starting point. And as young people, we also need to be involved in the implementation and accountability process. So next on the agenda, we have an input from Anshu Banerjee, who is the Director for the Department of Maternal, Newborn, Child and Adolescent Health and Aging at the World Health Organization, a long title, but certainly well earned. Anshu is a great ally for those of us working on adolescent and youth health, and it would be great to hear from him. So I'll hand over to Anshu.
It's wonderful to be part of this Global Forum for Adolescents and to launch today the second edition of the widely used AHA, which we've been working on for the last 2 years. Today I will present the highlights and key messages of the second edition of the widely used AHA guidance, which was updated based on new evidence. AHA is a direct response to a request by the 68th World Health Assembly in 2015 to develop global guidance for accelerating adolescent health programming. It takes a one WHO and a one UN approach. It allows governments to identify their national and subnational priorities and strategies to respond. The first edition is built on the momentum created by both the 2030 Agenda for the Sustainable Development and the UN Secretary General's Global Strategy for Women, Children's and Adolescents' Health. Today we are launching the second edition. So what is new in this second edition we are launching today? It provides updated data on the adolescent population globally, their mortality, morbidity, selected health outcomes, risk and protective factors, and determinants of their health and well-being. It also presents the latest developments to guide global and national measurement of adolescent health and well-being by featuring the recent consensus on core indicators for adolescent health and well-being. It also updates the evidence base on what works to improve adolescent outcomes globally. In relation to recent advances, the last 5 years have seen the launch of major global initiatives such as the Making Every School a Health Promoting School. Further, new evidence has become available on quality of care in support of universal health coverage. New evidence synthesis has helped to better inform actions by sectors other than health to become more responsive to the needs and concerns of adolescents. This edition has also integrated learnings and case studies from the application of the first edition of the AHA from many countries which have used the guidance to develop or update comprehensive strategies and plans for adolescent health and well-being. Also, the thinking about adolescent well-being domains has evolved, and a consensus framework for defining, programming and measuring adolescent well-being was developed resulting in moving from a largely health-centric perspective to a more holistic understanding of adolescent well-being, including its implications for programming. The unprecedented school closures and lockdowns around the world during the COVID-19 pandemic have affected the learning, development and well-being of adolescents worldwide. This and other lessons from the pandemic are brought into the second edition of the guidance to inform the building of resilient educational and other systems critical to adolescent health and well-being. Importantly, the revised version emphasizes topics and issues adolescents and young people wanted to see covered in the second edition. Our consultation exercise with over 600 adolescents and young people identified mental health, SRH, access to healthcare, adolescent involvement and engagement, and social determinants of health, amongst others, as key issues to be addressed. These add to the continued focus on the need for a comprehensive approach to adolescent well-being, recognizing relationships between health outcomes, linkages between risk factors, and the value of early investment. In the last 6 years, scientific and political advances have been made to promote adolescent health and well-being. Examples are the articulation of well-being for adolescents by the UN agencies, linking progress in UHC to progress in adolescent health, as well as the unprecedented attention to school health. Also, the investment case has highlighted that preventing non-communicable diseases during adolescence yields US $400 billion over 50 years. The UN has strengthened its work with and for youth. Adolescents have gained more visibility in health agendas, and monitoring adolescent health and well-being is improving as well. Since the launch of the AHA in 2017, the need for a comprehensive approach has been amplified over the last few years. The investment case brings new insights into the benefits of investing in a comprehensive package of services for adolescent health and well-being. The political declaration on UHC in 2019 stressed the need to comprehensively address a broad range of health problems and their social, economic, environmental and other determinants of health by working across sectors. This was reiterated at the UN General Assembly 3 weeks ago during the high-level meeting for universal health coverage. The COVID-19 pandemic highlighted the need to have a holistic response to the pandemic that included the totality of adolescents' needs. The WHO UNICEF Lancet Commission, A Future for the World's Children, called for a comprehensive narrative that places children's and adolescents' health and well-being at the center of decision-making. The Adolescent Wellbeing Initiative proposes a consensus conceptual framework for adolescent well-being that consists of 5 interrelated domains. The Health Promoting School Initiative calls to put learners' health and well-being at the core of the education agenda by investing in health-promoting education systems. And the Lancet series, Optimizing Child and Adolescent Health and Development, provides evidence of the effectiveness of a comprehensive intervention package for adolescents across a range of priorities and delivery platforms. By the end of 2022, the AHA guidance had been used to inform national policy in most countries in the WHO regions of Africa, Southeast Asia and the Americas, along with select countries in the Eastern Mediterranean and Western Pacific regions. The guidance was an influential framework for informing and realizing political commitments from several regional initiatives, such as the Adolescent Health Flagship Program for Africa, the Plan of Action for Women's, Children's and Adolescents' Health 2018 to 2030 of the Pan American Health Organization, the Regional Framework of Joint Strategic Actions for Young People of the Eastern Mediterranean region, and the European Region Adaptation of the AHA. The experiences show that the guidance can be adapted to different contexts and levels of the health system, as well as improve involvement of young people and multi-sectoral approaches. The AHA guides countries through a systematic approach to develop health and well-being. It provides information on what the key arguments are for investing in adolescents, helps identify the main causes of ill health, then provides a menu of evidence-based interventions, helps conduct a needs assessment, and then finally explains how to set up a program for adolescents and also shows how to measure impact of the program. This all needs to be done with engagement of adolescents. It also provides guidance how to do this in special settings, such as in humanitarian situations. Finally, adolescents are not simply old children or young adults. Well-being is more than the absence of disease. It means optimum nutrition, good education, connectedness, agency, and supportive environments. Effective solutions exist, and they should be available to every adolescent. In relation to sectors and stewardship, multi-sectoral action is crucial, and it requires strong stewardship across government. Ownership by adolescents, for adolescents, of decisions affecting their lives is a right, and the multiplier effect throughout life and across generations results from investments in adolescent well-being. Equity means every adolescent counts. In short, AHA says awesome. Thank you very much for your attention.
So I think we've seen there a very comprehensive overview of the new AHA guidance from Anshu, the director of WHO. And if I were to pick on one point in particular, I think it's that co-ownership between all stakeholders. So Anshu spoke in particular about how this was mandated by member states at the World Health Assembly, how it engaged all of the UN agencies in the development, and critically how this is co-owned by adolescents and young people and how they've been engaged and led on the process. And we've heard some of the great testimony from Shukti already earlier today. But now what I will do is hand over to some of my colleagues and the other stakeholders. So in particular, we'll be hearing from some of our colleagues working in member states on the ground on adolescent health and well-being, as well as from some of our UN agency colleagues. So first we'll be hearing from the countries.
Hola, soy la doctora María del Carmen Calle, secretaria ejecutiva del Organismo Andino de Salud, Convenio Hipólito Unanue. Yo trabajo con 6 ministerios de salud, el Ministerio de Salud de Bolivia, Chile, Colombia, Ecuador, Perú y Venezuela. Y estoy sumamente contenta.
And I'm extremely happy because the global accelerated measures to promote adolescents' health, the famous AHA, will be launched. And this guide serves as a guideline for the countries to provide health for adolescents, so their health and well-being is much better. What is my experience? In 2017, when I was General Director of Strategic Interventions in the Ministry of Health and later Deputy Minister of Public Health, we applied this guide and it really did yield results. For this new version, we have also sent our ideas, our comments, and we know very well that this is extremely important to improve policies, programs, projects dedicated to adolescents. The idea is that the approach has to be multi-sectoral and that we have to recognize that there are different types of adolescents. And obviously, we all have to participate so that the application of this guide, which is orientation guide, a guideline for all countries, is successful. From the Andean Health Organization, Hipólito Unanue Convention, we promise through our Andean Committee on Adolescents that we will collaborate for the implementation of this guide in Bolivia, Chile, Colombia, and Ecuador, Peru, and Venezuela. We see you soon.
Pakistan is world's 5th most populous country, with around a quarter of the population between ages 10 and 19 years. There is a significant urban-rural and gender-wise divide, posing greater challenges in promoting adolescent health and development agenda. Pakistan committed to operationalize the Accelerated Actions for Health of Adolescents framework at the 64th Regional Committee of Eastern Mediterranean Region in 2017. The Ministry of National Health Services, Regulation, and Coordination led a needs assessment and landscape analysis exercise in 2018 to inform the strategic prioritization workshop involving multi-sector stakeholders to draft the national strategy on adolescent health and development in Pakistan. A national consensus building workshop was also organized in 2019, and the Pakistan National Strategy on Adolescent Health and Development was officially approved in 2020. During the consultative workshops, adolescent girls and boys participated from inaugural to closing. They also delivered keynote messages at the opening session, which was presided over by the Federal Parliamentary Secretary for Health, Dr. Noshin Hamid. They joined the group discussions on various thematic priorities and made significant contributions by sharing their perspective and life experiences. They also presented the results of group discussions in the plenary, owing the final outcomes from thorough exercise. Resulting from the thorough consultative and participatory process, including voices and choices of adolescents, the Ministry of National Health Services, Regulation, and Coordination officially approved the Pakistan National Strategy on Adolescent Health and Development. National Strategy has paved the way for Pakistan to realign the focus of reproductive, maternal, newborn, child, and adolescent health policies and plans to keep adolescents on priority agenda. The recently developed Universal Health Coverage Benefit Package with clear adolescent health-focused interventions is a testament to it. Another live example is the adolescent-centered activities integrated into the Ending Preventable Maternal Mortality and Every Newborn Action Plan, Joint Country Action Plan finalized by the government of Pakistan. There is growing focus on the issue of adolescent mental health, and the country will adapt the global guidance to develop a training program engaging available large-scale platforms engaging directly with adolescent girls and boys. For example, Pakistan Girl Guide Association and Pakistan Boy Scouts Association. The country is fully committed to leverage the full potential of its adolescents and young population for a prosperous future.
В нашей стране за последние десятилетия, конечно, достигнуты очень хорошие результаты благодаря системным мерам. По данным Комитета по правовым учетам и статистике Генеральной прокуратуры, за последние 7 лет количество суицидов среди подростков 15-17 лет снизилось на 28%. Но эта, значит, проблема остается наиболее актуальной, потому что этот период жизни и факторы риска, которые могут повлиять на здоровье детей, являются наиболее такими, заостряют внимание политиков здравоохранения и вызывают серьезную обеспокоенность в целом правительства Казахстана. Сегодня Министерство здравоохранения решает вопрос повышения уровня доступности и снижения барьеров для оказания помощи и поддержки в области психического здоровья. Законодательно определена необходимость поддержки в области психического здоровья в рамках школьной медицины. Отдельно урегулированы вопросы предоставления услуг по охране репродуктивного психического здоровья детям от 10 до 18 лет, определяющие конфиденциальность получения любой помощи по самообращению, медицинской, психосоциальной, юридической помощи. Для обеспечения территориальной доступности создано около 200 молодежных центров здоровья. И необходимо отметить, что на сегодняшний день произошла интеграция службы охраны психического здоровья на уровень первичной медико-санитарной помощи. Теперь помощь и поддержку оказывают мультидисциплинарные бригады, врачи общей практики, психологи, социальные работники, педиатры. В то же время специализированная психиатрическая помощь может быть оказана в поликлиниках по месту жительства. Для этого развернуто 77 первичных центров психического психического здоровья на уровне ПМСП, в городских условиях более 200 кабинетов психического здоровья на сельском уровне. Еще раз хочу подчеркнуть приверженность правительства в этом вопросе. Конечно, без современных и актуальных научных исследований сложно улучшать помощь. На сегодня появляются все новые и новые данные. В этом году уже запускаем исследования по негативному детскому опыту, на следующий год эпидемиологические исследования по распространению зависимости от психоактивных веществ. Как ответ на...
Good morning, ladies and gentlemen. I'm Dr. Slavut Bunsuk, Deputy Director General of Department of Health, Ministry of the Public Health, Thailand. Today, I would like to present about the health promoting school and One School, One Health Teacher project. According to the collaboration between the Ministry of the Public Health and Ministry of Education have jointly implemented project to promote adolescent health to health promoting school and health literate school approach. We aim to improve knowledge, encourage healthy behavior, and empower school health teachers who play a key role in the public health, integration, and guiding students toward a healthy and high-quality future. This initiative aims to develop human resources for the 21st century. Therefore, we launched a curriculum named Health Teacher for Health Literate Thai Children under the One School, One Health Teacher project. The importance of the project, the One School, One Health Teacher, Building Health Literacy Among Thai Children project is a comprehensive development program for Thai children. This project is also in accordance with the collaborative agreement policy of the 12 ministries. The goal of this project are known as the 4H. The goals comprising the head, heart, hand, and health. This is an important issue. We expect this project can improve the skill of the mental health and physical health of the whole student in Thailand. Thank you.
Hello everyone, I'm Prerna Banati from WHO. We've just heard 4 country testimonials from Thailand, Pakistan, Kazakhstan, and Peru, who have just shared their commitment and action to improving adolescent health and well-being. We'll now move to hearing from our UN partners. Today, we welcome 7 agencies. We are making progress in doing this? And how can the UN and your agency best support governments in making change in their country? We'll start with Danielle Engel from UNFPA. Danielle, over to you.
Well, thank you very much. And I'm very pleased to be here and represent the United Nations Population Fund and this exciting launch of the second 2.0 of AHA. We have been involved from the very beginning with developing AHA. So very happy to see the second iteration. To your question about a comprehensive agenda. To ensure that adolescents and youth can thrive on their road to adulthood, what we really need is integrated policies and programs which address the whole person. And as we are at the verge of celebrating the 30th anniversary of the ICPD, the International Conference for Population and Development, which is which our work of UNFPA is of course deeply rooted, I'd just like to remember and recall that governments in 1994 actually agreed and committed to put the young people in the center and ensuring access to education and health, including sexual and reproductive health. and UNFPA is the dedicated agency to implement this mandate. And our adolescent youth strategy, My Body, My Life, My World, which speaks directly to the AHA framework as well, is our commitment to a comprehensive approach to dedicate and a dedicated work with and for young people.
Thanks so much, Danielle. Now over to Linda Keys from WFP. Linda, over to you.
Great. Thanks very much. And again, I'm very happy to be here and to participate on behalf of WFP at the launch of AHA 2. I think it's really important to acknowledge a lot of the progress that we've made, but reaching adolescents to improve their health, nutrition, and well-being is still a challenge in many contexts. So we must take advantage of all the opportunities and link different platforms that we all are contributing to. In some settings, for instance, we find that we can engage adolescents around food and nutrition. For instance, in humanitarian settings, we can often engage adolescents to ensure that their households can access food and nutrition. And then using and building on this connection, we can link them to platforms and services to meet their other needs. Nutrition across the life cycle is now fully integrated into WFP's organizational strategic plan and within our country's strategies. WFP is therefore committed to strengthening the connections across the different sectors, the different systems, and the platforms that we engage in for adolescent health and well-being as part of our engagement in food security and nutrition in humanitarian and transitional settings.
Thank you so much, Linda. Now over to Valentina Baltag from WHO. Valentina, over to you.
Thank you, Prerna. WHO mandate for comprehensive agenda is enshrined in our mandate for universal health coverage, because universal means universal also in terms of the range of services to be provided. And to your question, are we making progress at the country level? I must say, yes, we are making progress. We are not yet where we want to be, but every single country that has used the first edition of the AHA guidance to update or develop a new adolescent health plan made it with a very intense youth involvement from the beginning to the end. I want also to reiterate that, as our Director General says, the lack of progress towards UHC is not as much a technical problem as a political problem. Therefore, WHO works tirelessly to influence the political discourse. And the latest example is the political declaration of the UN high-level meeting on universal health coverage 2023 that calls inter alia to integrate a focus on youth to leave no one behind, and calls for age-appropriate integrated services to ensure the needs of the population across the life course. Thank you, and over to you, Prerna.
Thank you, Valentina. We'll now hear from Nazneen Damji from UN Women. Over to you, Nazneen.
Thank you so much. We're pleased to have been involved in AHA 2.0 and to be part of this conversation. At the halfway point to 2030, there's global recognition that the success in achieving the SDGs, including the one on health, actually hinges upon the achievement of SDG 5 on gender equality and the empowerment of women and girls. And unfortunately, there's still a way to go to realize this vision. As UN Women, we're fully committed to promoting health and well-being of young women and adolescent girls, and particularly in demanding to ensuring that adolescent girls, and particularly adolescent girls and young women, are able to access health and to be able to have fruitful lives. So to make impactful change, we're really promoting adolescent health and well-being through the lens of gender equality and the empowerment of women. And we're supporting this through transforming unequal gender norms and practices, repealing discriminatory laws, integrating gender equality into health-related policies, programs, and budgets, mobilizing communities, traditional and faith-based leaders, and nurturing the leadership of adolescent girls and young women themselves. Thanks so much.
Thanks, Nazneen. Now we'll hand over the floor to Christopher Castle from UNESCO. Chris, over to you.
Thank you very much. And UNESCO is also very pleased to continue our partnership and engagement in AHA and our commitment to adolescent health and well-being. Of course, at UNESCO, as the UN agency mandated for education, we consider education a really critical entry point for supporting young people's health and well-being more broadly. UNESCO was involved with other UN agencies to release a new report called Ready to Learn and Thrive, which was released in February earlier this year. And it really confirms what we all know, which is that health, nutrition, and well-being of learners is a key determinant of education outcomes. So healthier learners learn better. And so that's really important for all of us to keep in mind. One of the things that we saw last year at the UN Transforming Education Summit was how critical young people's involvement is. Have to be in the driver's seat of learners is a key determinant of education outcomes. So healthier learners learn better. And so that's really important for all of us to keep in mind. One of the things that we saw last year at the UN Transforming Education Summit was how critical young people's involvement is. They have to be engaged, they have to be in the driver's seat. And so all of us in the UN have to do our part to support countries to meet that holistic set of needs, and AHA provides us with a great framework for that. In UNESCO, we particularly focus on supporting countries to deliver good quality, comprehensive sexuality education, working with UNFPA and other partners to make sure that young people achieve that right that they demand, good quality education that includes comprehensive sexuality education. Thank you.
Thank you, Chris. Now we'll hand over the floor to Joanna Lai from UNICEF. Joanna, over to you.
Thank you so much, Perna. And we at UNICEF are also very glad that AHA 2.0 is launching today. And UNICEF's commitments to health and well-being of adolescents are integrated across 5 goal areas of our strategic plan as part of our overall mandate to ensure all rights of children, which includes adolescents. And this means, our mission is focused on advancing policy action and program across systems and across sectors to address the risks, but also boost the protective factors that impact health and well-being outcomes for adolescents. And at the core of our work really is partnering with young people themselves and also strengthening the platforms and the capacity of adults to work with adolescents. And I believe that there has been progress at the regional level, at the global level, at country level in this regard, as we've seen an increase in participation of adolescents in decision-making forums, advisory groups, from school councils to youth parliament to taking leadership positions. And I think that this kind of engagement has been a key reason why we have seen stronger integration of adolescent priorities into national and subnational policies, strategies, budgets, and action plans that impact their health and well-being. And it's really, really great to see this kind of emphasis in AHA 2.0 on the role of young people. And I think this is going to be a critical aspect in making further progress on health and well-being outcomes for adolescents.
And now over to Suad from UNAIDS. Suad, over to you.
Thanks so much, Rina. And on behalf of UNAIDS, I would like to congratulate you for the launch of this second edition of AHA and the work that has been put into it. We were very glad to have contributed. UNAIDS Secretariat plays a crucial role in advocating and coordinating the HIV response for children and youth through the convening of UN co-sponsoring organizations and multiple sectors and stakeholders at all levels to ensure comprehensive, tailored, and integrated political and programmatic approach to end AIDS among populations. This is why UNAIDS has partnered with UNESCO, UNFPA, UNICEF, and UN Women in launching the Education Plus initiative to advocate for a holistic, multi-sectoral approach to prevent infections among adolescents, girls, and young women by positioning secondary education not only at the right, but at a key pathway and in a strategic entry point for layered interventions to protect them against HIV at all levels.
Thank you, Suad. And thank you to our UN partners for participating in today's panel and for their continued commitment to adolescent health and well-being. Now we'll return back to Gareth. Gareth, back to you.
policy about education, which is the National Education Policy. So we consulted a bunch of young people about this policy and asked them about their concerns. And I'm sorry, am I audible? I think I disconnected.
No, it's fine. Shukti, you can keep going.
Oh, yeah, sorry. We asked them about their opinions about the national education policy. We asked them what they want to change within this policy. And all of us collated those suggestions and passed them on to the government. And also we spoke about the national youth policy in India, about what changes young people want within certain sections such as health and well-being, and how their voices need to be represented. And all of these suggestions were collated and sent to government authorities. So I think these are just some of the ways in which young people can be represented and have their voices heard. So yeah, thank you. And over to you, Karen.
Brilliant. Thank you, Shukti. So yeah, I think it's so clear that as young people, we do need to be actively engaged in that and working with our partners, stakeholders, agencies, governments, etc., to take part in these consultations, have our voices heard, and also collect the data that we might have access to that they don't. And on that point, I think data is a clear theme and a clear issue in terms of identifying health needs for adolescents. Obviously, within AHA, everything is evidence-based. So perhaps I can ask WHO here, what do we do if there is very little data or information on adolescent health and well-being and the status of that in a country?
Gareth, I can try to answer these questions. And indeed, this is a very often situation we encounter when we go to countries. But there are some things that you can do even in the absence of data. First, talk to other sectors and partners. You will be surprised how many data are sitting there and not necessarily being used, because sometimes, for example, criminal justice systems or telecommunication system will have data that are very useful to be acted upon by other sectors, health sector included. We saw this, we witnessed this during the AHA workshop when countries used the first edition of the AHA guidance. When you put sectors together and people start to talk and find out what are the management and information systems in other sectors that can help have this full picture of the health and well-being of adolescents, then there is more data than the traditional kind of health sector centered people would think of. So that's the first one, talk to other sectors and partners. Second, if you don't find data on certain or the key areas of health and well-being for adolescents, look at the estimates. We, WHO, one of our function is to monitor health and trends. And in doing this, we also face this issue that we don't have good data from country to have global and regional estimates, but we produce estimates. What are estimates? Is our best guess based on some objective criteria what might be the levels of mortality and morbidity in a given country, in a given region, and globally. So this is not a perfect, but it is something you can start with. And our department produces and maintains a data portal. If you Google maternal, newborn, child, adolescent health and aging data portal, and I will ask colleagues who are in the room to put the link in the chat, you will be surprised how much data you can find on your country. Data on behaviors, data estimates on mortality, estimates on morbidity. Use this. Third, if you don't find data estimates even for your countries, use regional and global estimates, more useful regional estimates to start a discussion in your country. Because if, for example, mental health condition is the #1 cause of ill health in, say, 5 out of 6 regions, then it is likely it is an important cause of ill health in your country as well. So this is not useful to go to the granularity, but it is useful to start a discussion. And finally, acknowledge the gap. Put as an action in your plan to improve your system. And then next time you will be in a better position. Over to you, Gareth.
Fantastic. Thanks, Valentina. We've only got very short amount of time left. And one of the questions here is about actions for governments. So perhaps Suad, as sort of the representative from UNAIDS and a joint program of agencies, is there any program or initiative that really speaks to you very quickly in terms of governments having taken action to improve adolescent well-being?
Yeah, well, I mean, we have lots of good examples from countries where we've seen useful, meaningful youth engagement in like the country coordinating mechanisms in national AIDS councils, even in regional AIDS coordination bodies, and even at the global level in UNAIDS program coordinating board. However, this is not the rule, and the participation of adolescents or youth is not always designated or institutionally mandated. So we must all understand and tackle the barriers to youth engagement and build our own internal capacities to mainstream the principles of meaningful youth engagement. As UNAIDS Secretariat, I would like to share that we are leading on the development of a global framework to strengthen sustainable youth-led HIV response and youth-led organizations in order to generate a shared understanding of the definitions of youth-led response and youth-led organizations in the context of HIV and how to engage and support youth as partners and as leaders in the response.
Brilliant. Thanks, Suad. And I think, as always, we'll be learning lessons from the HIV response and youth leadership in that. So that almost draws an end to our panel. I'd like to thank WHO, UNAIDS, and UNFPA, UNICEF, WFP, UNESCO, and all others that joined, and in particular, Shukti, our youth leader, who was able to join us live and share some of her knowledge and wisdom on youth engagement. Finally, we have our closing remarks from Eno George Stevens from the Digital Transformations for Health Lab. So I'll hand over there.
Good afternoon, esteemed policymakers, fellow young people, and all present today. Over the course of today, we have been reminded of the essential nature of the AHA guidance, its very essence, to prioritize and address the unique health needs of adolescents and young people. What inspires me most about this guidance is its origin. Not only does it emerge from the collaborative efforts of global health giants, but it also springs from the voices of my peers, adolescents and young people who dream of a world where every young person thrives. While the testimonials today from various countries shed light on how the AHA principles have shaped public health initiatives, it also underscores the need for continuous commitment. To the policymakers here, we urge you to embed the principles of AHA 2.0 deeply within your agendas. Let it not just be a guideline, but a blueprint for action. To my fellow adolescents and young people, I implore you to be vocal, be informed, and be the change you wish to see. I thank you.